Hi, I'm Julie Bradshaw. I'm a diabetes specialist podiatrist working within the NHS, and I'm here today to introduce you to the pre-ulcerative callus risk assessment tool. But firstly, as a background, here are a few figures. So firstly, in the UK, at present, there are 4 million people living with diabetes, and it's said that by 2025, this figure is actually going to rise to 5 million. And studies suggest that up to 15% of people with diabetes will have a foot ulcer in their lifetime, and that equates to roughly 1 in 7. Throughout England, there are around 60,000 ulcers recorded every year, and the very sad statistic is that 42% of those patients will actually die within 5 years. Getting people with diabetes to take care of their feet is a real huge challenge. If we can help them understand the risks that diabetes presents to their feet, then we can help them modify their behaviour and therefore reduce the risk of getting a foot ulcer. The pre-ulcerative callus risk assessment tool is designed to quickly assess skin condition in the diabetic foot. The tool summarises information from studies published in peer-reviewed journals, such as the Diabetic Foot Journal. So stage 1 simply asks if the patient has diabetes. Any patient with diabetes has an increased risk of having foot complications compared to patients without diabetes. Stage 2 of the tool uses photographs from the Young Townsend Foot Skin Scale for Diabetic Neuropathy published in the Diabetic Foot Journal in 2014 and is recognised as a definition of callus by clinicians across the UK and beyond. The photographs allow for a consistent interpretation by health professionals of the risk associated with dry skin in patients with diabetes. Levels 1 and 2 indicate the need for the dry skin cream, which is a 10% urea base, and that maintains skin hydration. Levels 3 and 4 require a more powerful heel balm, which is a 25% urea-based balm. So carrying out an initial visual foot skin assessment, what we're going to look at is any of the weight-bearing surfaces. And on this foot, clearly there's just some dry skin over here, so we'd put that as a level 2. And then we've got this part of the foot, which is a non-weight-bearing surface, and we'd put that down as a level 1 because it's just a little bit dry. However, when we get down to the heel, what we've got is a build-up of callus with fissuring, which is quite important to take that into account in terms of foot ulceration. Potentially that could break down, so therefore we'd want to actually get rid of that callus, so we would put that down as a level 3, therefore using the Dermatonics Once Heel Balm, which contains 25% urea. Stage 3 lists the additional risk factors for the diabetic foot as laid out in the current NICE guidance NG19. So these include neuropathy, which is lack of sensation, limb ischemia, which is a poor blood supply, ulceration, foot deformity, infection and inflammation, and existing or previous Charcot foot. You're not required to actually diagnose these risk factors because these require a clinical diagnosis. Stage 4 is hugely important to communicate to your customers. This is a diagram that's been published in an American journal, and it succinctly shows the alarmingly simple process of a diabetic foot ulceration. Stage 5 illustrates the risk triangle associated with diabetes and foot disease. So therefore those with neuropathy and callus, that means they're high risk, they have 2 risk factors, are 84 times more likely to ulcerate than those of a low risk, i.e. patients with no risk factors. 80% of amputations are preceded by a foot ulcer. So if we can reduce the likelihood of a patient having an ulceration, we can therefore reduce our amputation rate. Currently in England, there are 169 diabetic foot ulcers each week. That equates to 1 every hour. Stage 6 shows effective Dermatonics Once Heel Balm in photographs all supplied by NHS clinics with patients' consent. Dermatonics has clinically proven unparalleled evidence of its effectiveness. Ordinary creams are not designed to remove callus, and there is no proof of their effectiveness in treating callus, whereas Dermatonics Heel Balm has shown conclusively to reduce callus. Patients who have diabetes need to be extremely careful about how they remove their callus when using a pumice stone in a foot file, as this can actually lead to a break in the skin, which could cause an infection and an ulceration. I've seen many of my patients' foot skin improve dramatically with the use of Dermatonics Once Heel Balm. Alongside my colleagues, we would recommend this product as being the best available of its kind. We recommend it to our patients, and therefore I'd highly recommend it to you as well. In April 2020, the Diabetic Foot Journal published a study that took place at the Whittington Hospital. It showed that Dermatonics Once Heel Balm was effective in removing all the callus from 96% of patients with diabetes. in just 2 weeks. This level of the proof of effectiveness is unmatched. So that is the pre-ulcerative callus assessment tool. If you see anything unusual during your foot check, such as a darkened area underneath the skin shown in this picture, please err on the side of caution and refer your patient to the GP. Ulceration costs lives, so every foot check will help to reduce those risks. In the UK, all patients with diabetes should undergo a minimal of an annual foot assessment within their local GP practice. This check therefore does not replace their annual assessment. If you have any questions, could you please call or email Dermatonics using the contact information on the screen.